We're back with Christine Hrudka talking about medical cannabis, and a little bit more, Christine, that we talked about was in terms of the effect of the medicinal cannabis on what you're treating. Now, there's the opioid crisis that we had, kind of touched on earlier. What do you see as a transition between the medicinal cannabis and some of the painkillers that are currently out there? Is there a lot of difference?
Well, Randy, we, as you know, the opioid crisis is upon us, and truly, when I went to school, we had no idea of how addictive the painkillers are that we were prescribing. And over the last 10, 15 years, we've been prescribing, doctors, we've been dispensing unbelievable amounts of these. And of course, now we've come upon a whole generation of addicted people who are addicted to opiates. So I believe on the chronic patient with chronic pain that medicinal cannabis has a role. So right now, I could see us with a patient who's been on opiates for years, us adding CBD, large component with a little bit of THC, right to their opiate, and then slowly tapering them down on it instead of just having them go cold turkey. So I really believe that this product has some role in helping us alleviate some of our opiate crisis that we have, and I think it will absolutely become a tool that we'll use to treat new patients who have chronic pain. So we hopefully won't be putting patients on this high dose of opiates and leaving them on there till the point that they're addicted. So,
what do you see as an effect if someone has 30 or 50 employees, and some of them are driving heavy equipment, trucks, tractors, on oil fields, for example, or in mines, but they do have some chronic pain? Would that be something that could be prescribed, or is that between a physician and the patient, depending on their career choice?
yeah, I think if someone has driving as part of their job and have chronic pain, I think again the really high CBD component with just a very little bit of THC might be acceptable, and their level of impairment would be very little. Again, it's that THC part that causes the impairment. Now, there's been studies on just using CBD for pain, and yet that has not been quite as effective as adding just a little bit of THC. But I do think if somebody who has a job that needs to operate machinery, I do believe there is still a role with medicinal cannabis as long as we have the high CBD component as part of that.
And would that be more or less of a risk with regards to any pills that they might currently be taking? I guess that's what the jury's out on?
That's what the jury is out on.
Right.
I would like to suggest to you that there are people who are on high doses of painkillers are probably impaired while they're working, if they are working with the machinery and on opiates, and we just don't test it.
Right. Yeah.
So, I'm sure right now there are people driving who are on high doses of opiates. That I think that this might be definitely an alternative.
I guess if I was to compare, alcohol wasn't legal years ago, now it's legal. There is some misuse, and that does cause, accidents and death. That could potentially happen with the recreational component that we see. In your mind, would someone be able to consume this in a cafe, or if it's edibles that it's in the form of, would you say that would be a thing that could be allowed? I guess comes back to the THC component again.
Yes.
Yeah.
I really believe that the legalization here of marijuana or even recreational is a good thing. We have products on the street right now that we have no clue what's in them. They can be grown in somebody's backyard. They can be laced with fentanyl. So we will have a product that we know what's in it. The products right now out there have huge high THC levels, higher than they've ever been in the history, because people want people to buy their products. So they, of course, have this high THC level that causes an extreme high, I believe leads to a psychosis in some people. So we will have a product that will be the same across the country as far as the levels of THC when July comes
Right.
for recreational use. So we're hoping that alone is going to make it much safer for use.
So the end user, the consumer, would have some assurance and a standard
Exactly.
of consumption, whatever it is that they're doing with it.
Of quality of
Exactly.
what's in the
Yeah,
product.
yeah. Is medicinal cannabis taxed, or does it look like it's going to be taxed as opposed to recreational?
Right now, the federal government is saying yes, and there are many groups, patient advocates, who are hoping to get that reversed, saying that's not fair because no other prescription or drug.
Yeah, it's not my fault that I have
Yeah,
pain,
it's
right.
not my fault.
Yeah.
It shouldn't be. I think that will be considered. I'm hoping by the federal government to change that, and maybe that will happen as we move into the spectrum of viewing medicinal cannabis as a drug. As of right now, no, it will be taxed. So,
Can you share any costs that are involved there, or maybe currently versus what are projected in terms of the actual product?
what I'm understanding is that it will be sold for $10 a gram. In whatever, however government decides, however provincial governments decide to sell it. 1 gram will make you about 2 joints, just for a comparison, or 1 gram will produce about 0.6 mils of oil, which isn't very much, and that will be around $10 also. That's the projected. Out of that, there'll be taxes, of course. That will be, I'm understanding about 75% of the taxes will be going to the provinces.
So it is a bit of a, I wouldn't say cash cow, but there is a funding stream, if you will. Do you think that there would be a spike, perhaps, of the number of people that are prescribed with it, and then a leveling off? Like, is it good for your lungs, and can you continue to use it even from vaping versus the smoke? Would people find that uncomfortable? Or?
Yeah, I think there will be, as we all become educated, I think there will be an uptake in the use of it medicinally as we have more studies that produce outcomes that we can really measure. I think we will have an uptake in use of it, especially with the opioid crisis that we have. I think recreational, I think it'll become used largely. There'll be a spike, and then there will be a leveling. If you look at Colorado, there was a huge spike in uptake when they allowed it recreationally, and then it now has really leveled off. So medicinally, my guess is it will be a growth upward as we become educated, easier to get, more indications of where we should use it.
I know that just following Colorado, because it's not a national program in the United States, that it's primarily on a cash basis because of the banking systems and so on. We'll be able to purchase that here just on any credit card or cash or debit, whatever it is that you currently
Yes,
do at
that
your
is my
pharmacies.
understanding.
Yeah.
Yes, recreationally, you'll be able to use whatever form of currency.
And a pharmacy, as far as we understand today, will not sell recreational cannabis.
No, not right now.
So I still would envision people doing this out of the storefronts, let's say. And in your mind, knowing what you know and bring to the table, do you think that on the recreational side that there would be more of the cafes and things like that where it's generally more accepted. So I would go and buy a bottle of beer, have a glass of wine at a drinking establishment. Would I be able to go to a cannabis cafe of sorts and have brownies and gummy bears and that type of thing and consume them on site? Is that something that you see on the horizon?
I think that is part of the entrepreneurial spirit
Yeah,
that
yeah.
could definitely occur. I hope that we get to see the entrepreneurial spirit come alive here, and we set parameters so that people can own the places for the distribution of the recreational. And absolutely, I could see, as other parts of the world, cafes where you would go and
Yeah, we're not first in that
no,
sense. Yeah.
exact. There are other parts of the world
Yeah.
that do have that. I hope that we can see an entrepreneurial stream where there are, of course, there are controls of who gets at age, making sure they check for age, making sure that there's really strict rules on distribution.
Christine, I want to thank you and all of the good work you've been doing, and good luck with your role and chair of the Canadian Pharmacists Association this summer. Thank you for making time, and we'll maybe talk again this fall.
Yes, we'll have a much more clearer landscape.
Perfect, thank you.
Thank you.
We'll be right back.